I'm Dr. Meena Venkatraman. I'm a consultant pediatrician at Cloud9 Hospital, Varttur Road and Old Airport Road. A newborn baby in the first 4 weeks of life is called a neonate. While this period can be very exciting for parents, it can be stressful too. Here are some must-know tips for parents to handle their babies in the first month of life. So let's look at the safety tips first that everyone should follow. A newborn has a very frail immune system, so washing hands before handling the newborn is very important. You should also insist that visitors who come to see the baby also wash their hands prior to handling the baby. The second point is to support the baby's head and neck and always cradle the baby when carrying the baby. And never shake your baby very vigorously, whether it's in play or frustration, because it can lead to life-threatening bleeding into the baby's brain. And always fasten the baby with seat belts when they are in the car seat or stroller. This will help prevent injuries. Now moving on to feeding your baby. So typically a newborn baby needs to be fed every 2 hourly, and approximately 8 to 12 feeds in a 24-hour period is necessary. So babies would typically urinate 5 to 6 times in 24 hours if they get adequate volume of feeds. After the initial weight loss period, newborns start regaining around 20 to 30 grams of weight per day for the first 3 months. So please focus on feeding the baby at adequate intervals. The next point is about the diaper hygiene. Babies can be in a disposable diaper or cloth nappy, but always clean the diaper area from front to back and use a cotton ball dipped in lukewarm water. And you can use a barrier cream like zinc oxide based cream to prevent a diaper rash. Never apply talcum powder to the baby's diaper area. The third issue to focus on is the umbilical cord area. So the umbilical stump remains in situ for 1 to 3 weeks after birth. The color of the umbilical stump may change from greenish yellow to brown to black, and it eventually falls off. So the area needs to be kept clean and dry, and you would need to clean it with alcohol swabs once a day to prevent infections. Babies would need to be burped after every feed because they tend to swallow air during the feeds. And bathing the newborn, you would need to wait to start normal bath until the cord falls off. They can get a sponge bath until such time. Regarding the baby's sleep, it's always safe to place the baby on the baby's back to sleep to prevent the risk of sudden infant death syndrome until the baby is 1 year old. And it's also a safe sleeping practice to avoid using pillows, soft toys, or any other small articles which can cause a choking hazard for the baby. And bonding with the baby is very important for the parents. So one of the techniques is what is called as kangaroo care, wherein you can have skin to skin contact with the baby. Place the baby on the bare chest and you can hold the baby's head and neck and the bottom, and this is a good way to bond and also comforts the baby and soothes the baby. Before bonding with your baby, it is important to stay away from cigarette smoke, avoid scented perfumes. You can sit comfortably, talk softly to your baby, sing, hug your baby, and play soft music, read to the baby. All this is a great way to bond with the baby. While all this can be overwhelming for new parents, it's also important that parents take some time out for themselves and get some help if they feel very stressed out. These are the warning signs or red flags in a newborn to head to the hospital immediately. If the baby has fever, which is temperature more than 100.4, you would need to head to the emergency room immediately. If the baby is not feeding well and not urinating 5 to 6 times in 24 hours, that's a warning bell too. And if there is any discharge from the umbilical cord, like pus discharge, or there's redness or thickness around the cord, you would need to see a doctor immediately. If there is worsening jaundice, the baby looks very yellow, or if the baby is not responsive, is very lethargic, that's again a warning sign. So if there are any warning signs, please reach out to your pediatrician immediately.